Hello, everyone, and a very warm welcome to today's ISNTD Connect. It's the first one after the summer recess, so I hope that everyone's been able to find at least a little bit of time to have a break. And it's really wonderful to be back for this new academic year. And this year, we really want to put the focus here at ISNTD on moving from advocacy to action, whether that be in research, in topics such as climate change, disproportionately neglected diseases such as NOMA. I think lots of very ambitious subjects, fields and remits where we really hope that through our regular exchanges, webinars, conferences, meetings and other media, we will be able to make a difference and really shift the dial on many of these neglected and tropical diseases. So to kickstart our year, it's my absolute pleasure to welcome Shanti Rochester. Hi, Shanti. Welcome.
Hi, Marianne. Thank you very much for the warm welcome and for having me today. And thank you to anyone that made the time to come here today as well.
Absolutely. And we've got I can see we have what looks like a really lovely and international audience, saluting Ikram Guizani, Rodrigo Magalhaes, Sam McGregor, Tolera Fufa, welcome, Lydia Manotti. If you do have a moment, please don't hesitate to jump in the chat. Say hello, tell us where you're connecting from, and we're really grateful you're here, and it's lovely to have a chance to get together in this way. So we're starting off this year with a really important topic, something that underpins, I could easily say, everyone's work on this call, and that is really the issues around data in underpinning and a absolute integral part of global health research. We have more and more data, but there are still really large gaps remaining. How to collect the data, who stores it, how do we share it, and so forth. So really a very important field. And even this week, we saw there was funding retracted for a very loved and used data repository for those working in vector-borne diseases, and that's really had a huge implication, and we've seen a huge movement even on social media trying to rethink what are we going to do about this and how can we do it. So Shanti, it's wonderful that you're here with us today to explore and unpack this topic. You are a data governance officer at the Infectious Diseases Data Observatory, or IDDO, based here in the UK. And IDDO has been really making very large strides in this field, bringing together not just tools and platforms to share data in infectious and emerging diseases, but also thinking about methods, governance, even the infrastructure to translate that data into the evidence that improves research, ultimately improving outcomes for patients and communities at risk of these diseases worldwide. So without any further delay, I will hand over to you. We're really looking forward to hearing much more about your work and governance suggestions on how we can make data in global health much more readily accessible, easy to share, and also ultimately having equitable relationships in this complex sphere. Shanti, over to you, and thank you for being with us today.
Thank you once again, Marianne, and to everyone. I will start the presentation. Okay, sorry, I was just testing it. This is working. So thank you, everyone. And as Marianne has kickstarted the talk, I am Shanti Rochester, the Data Governance Officer at the Infectious Diseases Data Observatory. And the talk today will be on equitable data sharing and collaboration in global health research. So why reuse data? I think this is a very important question, and I think it's a great way to start the conversation on what IDDO does and why it does it. So meta-analysis are quite important. And with the raw data, we allow to have better statistical power. We can carry out subgroup analysis of particular populations and understand the individual responses to treatments. In addition, data reuse allows increased robustness and analytical options by supporting prognostic modeling, it includes unpublished data. And in this way, it creates a standardized statistical strategies across different studies, across the world and within the field. However, data reuse is underpinned by data governance and data harmonization that are usually quite complex and onerous. Therefore, IDDO develops structures and legal documentations, among other things, for questions around data ownership, GDPR, equity credit, and data standardizations to increase interoperability of the data that is used for improving treatment and outcomes for neglected tropical diseases. So, to introduce IDDO, IDDO is a research unit and data repository based at the University of Oxford in the United Kingdom, and it works with collaborators across sub-Saharan Africa, Southeast Asia, and the Indian subcontinent mainly. It was initially funded as the Worldwide Anti-Malaria Resistant Network in 2009, and it has since its start aimed to promote reuse of individual patient data to inform the development and of evidence-based strategies to accelerate the treatment and control of neglected tropical diseases and infectious diseases affecting communities in low and middle income countries. To do so, the IDDO model is based on a repository infrastructure that gathers individual patient data from different studies to create a CIDISC standardized data sets which are in line with the FAIR principles to align researchers to address critical gaps in malaria, neglected tropical diseases, and emerging infections, whilst also providing governance and infrastructure to facilitate improved health outcomes and policy change in endemic regions. Many of you might be acquainted with the FAIR principles, but not maybe everyone. So I thought it would be important just to dedicate a few seconds to this. So what are the FAIR principles? These are quite important in the field of data reuse and global health. And in short, the principles of FAIR stand for findable, accessible, interoperable, and reusable. And in short, they emphasize machine actionability, which is the capacity of computational systems to find, access, interoperate, and reuse data with minimal or even no human intervention. So, the IDDO strategy articulates our mission and vision, which is to accelerate the treatment and control of neglected tropical diseases and improve the lives of thousands of people in low and middle income countries around the world. And through our strategy, we also set out the ways in which we want to achieve these pillars, the mission and vision. The strategy is made of three important pillars: the repository, which focuses on enabling research by improving the data infrastructure, by incorporating the FAIR principles; science, which aims to accelerate the effective treatment and control of the infectious diseases by reusing individual patient data for research; and equity, which is the focus of this talk, which is driving benefit of the data reuse to the community the data derives from and that are affected by the diseases we focus on. So, as I mentioned, equity is embedded in many of IDDO's activities as much as possible, which activities such as addressing evidence gap, in LMICs and neglected populations, ensure that academic credit is given to data contributors, collaborations of different types with researchers in and from low and middle income countries, develop trainings to support data collection, data management, and data sharing. And lastly, but not least, support the capacity building in LMICs through trainings and mentoring. Okay, so IDDO, IDDO works on a platform-based model. The purpose of data platforms, which are one for each of the themes, the diseases we focus on, serve to provide a resource for data reuse to generate new evidence. The development of each platform is always and only pursued with the continuous support of the communities affected by the disease. And the platform goes through a 4-step roadmap. So in the first step, we have the scoping. So in this phase, we focus on assessing whether a platform is needed in consultation with the community. In the scoping phase, engagement with the community is sought by assessing whether there are funding opportunities, whether there is evidence, so whether there is data availability, and how much data is available, if any, and obviously engagement with the community. Once we have found whether all of this is present, a platform can be deemed viable. If a platform is deemed viable, we move into development phase. At this stage, IDDO sets up the Scientific Advisory Committees, or SACs. The head of the SACs also sit on the IDDO Advisory Board, which direct and govern the activities and work of IDDO more broadly. And the SAC represent communities in countries that are affected by particular diseases and voice what the research priorities are. One key activity is the research agenda, which asks the community to identify which are the important questions that can be answered by an IPD meta-analysis. And the research agenda is particularly important because it drives the direction of the platform by establishing the priorities of data submission and which research projects can be carried out, and what are the most important ones. Currently, IDDO has 5 SACs. These are the ones we currently have. So for medicine quality, one, which is, as I mentioned before, for malaria, visceral leishmaniasis, schistosomiasis, and Chagas. Although we also have a lot of data for COVID. COVID is slightly different because it was an emergency response. So it didn't have to go through the same process of a neglected tropical disease. I just brought as an example the VLSAC. It's made of the representation from low and middle income countries is approximately 80% of the researchers, and they are from East Africa, South America, and the subcontinent, where visceral leishmaniasis is a critical disease. But we also have members of key NGOs like MSF and DINDI, which actively work on the therapeutics. So it's quite a diverse group, and it's a good way of having all these different people from the different not only countries, regions, but also different institutions and organizations to voice different priorities and IPD analysis that can be carried out. So moving forward from the development phase, the platform moves into the research phase, which puts in motion all the activities. There's a wide range of activities at IDDO. I am sorry for the effects. So collaborative study groups are developed using the research agenda as so the research agenda is used as a guide, and key collaborative study groups are key drivers of collaborative data reuse and evidence generation for critical research questions. And also study groups are a great opportunity for inclusion of the research that have generated and contributed the data. So we have a lot of study groups across different diseases. At this stage, we also maintain a robust governance infrastructure made of an interlocking framework of ethics, legal agreements, and regulatory compliance, which ensure that credit is given to data contributors, and it ensures that they are invited on research which uses their data and that their ownership is maintained. In addition, moving into the credit for reuse, it ensures that credit in the study groups, but also in analysis carried out by any other researcher, is given. IDDO has an established system of labeling with persistent identifiers, DOIs, which are linked with the people that create the data. And we ensure that DOIs are cited when data are used, and this allows to drive metrics and academic credit for data creators. Also, in this phase, we provide capacity building activities to generate research by supporting and training TDR fellows and students. And also we develop user-friendly tools to create more user-friendly data sets. And finally, the Data Access Committee, which assesses data access applications, which are requests for data, and assesses the scientific relevance and ethical feasibility of these requests that come through IDDO. So the Data Access Committee is an independent committee from IDDO. It's chaired by the TDR, which is the Special Program for Research and Training in Tropical Diseases on behalf of the WHO. And its members are selected through an open nomination process. The DAC is made currently of a bit less of 43 members because we've had some changes in the last days, but approximately 30 members across fields, skills, expertise, geography, and gender. And the vast majorities are from endemic regions. So currently we have around 20 members from low and middle income countries and less than 10 from high income countries. Across the continents where the diseases we focus on come from. The DAC is made of 1 chair and 3 vice chairs. And as mentioned, they assess data access application and the scientific relevance and ethical feasibility that it receives. So finally, once the platform has reached completed the research phase, we move into the impact. So from the scope into development to the research. So the impact of the research is providing benefit to the communities and populations affected by neglected tropical diseases and infectious diseases in low and middle income countries, and free data access and reuse to all around the world. An example of this would be, for example, the reuse of data from the malaria platform to update WHO guidance on dosing for small children in 2015. Oops. So I thought it would be also important of providing you with some metrics of IDDO's work. So currently we have received 124 requests. Well, we've received 129 requests for data reuse from 124 different organizations spread across the world, and we have shared over 126 data sets in total. We can see that the vast majority of researchers are based in high-income countries, but we've seen an increase in number of team members being based or from endemic regions, which is kind of a quite important metric to take into account, because we can see the capacity of more research in endemic regions engaging in these studies. And we've seen a bit more than 35 researchers based in LMICs that have requested data and are currently working and conducting studies, very important studies from endemic regions. We can also see in the last chart that we've also seen an increase of women leading research, which is quite an important metric when thinking about equity and the different aspects of equity that we're trying to take into account while increasingly improving and reaching out to people by showing the benefits of data reuse. This is another important metric. So since 2019 up to this day, this is where the data by disease has been shared. We can see that a lot of studies on COVID were carried out quite spread across the globe. So from Australia, Africa, we can see Southeast Asia, a lot in Europe, North America and South America. But we do see research on certain diseases being carried out primarily in the regions affected. So we can see Ebola data being backed in West Africa. We see schistosomiasis in Latin America. And we do see malaria spread across Southeast Asia, the Indian subcontinent, and Africa, which also is a quite important metric because it really shows that more capacity is provided to researchers based in these locations, and you have like in loco studies which can also affect policy change, treatment outcomes, and ultimately saving or improving lives worldwide. So with this, I would like to thank you once again for being here, and to all the strategic partners that allow us to carry out our work. We have a lot more partners, but these are partners that are particularly helpful in driving the equitable aspect. And many of them are not located in the global north, which is also very helpful. And yes, if anyone has any question, I would be very happy to answer that.
Shanti, thank you so much. A round of applause. I'm sure the audience will join me in giving you a virtual round of applause with me. Huge congratulations as well to IDDO for not just gathering these 126 data sets, but also really putting a lot of thought behind the governance, accessibility, making it quite comparable to facilitate this reuse by research teams around the world. So that's really wonderful. Thank you. It's been a pleasure to learn more about your work. And just to reiterate your words, if anyone in the audience did have any questions or comments, maybe you could even share if you yourself have used any IDDO resources, or if you would like to. Please don't hesitate to use the chat to kind of share your thoughts, comments, and any questions. But in in the meantime, well, first of all, you're getting lots of clap emojis. Ikram Guizani said very kindly, very interesting and inspiring. I couldn't agree more. Will Dial, bravo. Thanks for the summary. Thank you for these kind comments. And I suppose my first question, and now that we hear how much work IDDO, yourself, are putting into this, we stand at a really interesting inflection point when it comes to data. On the one hand, it seems things are getting a lot easier with kind of all sorts of things. I mean, very simply the internet, but also AI and how data can be collected and shared and stored in all sorts of devices and medium. But at the same time, are things getting more complicated in terms of the governance and the reuse? Where do we stand, and what, in your opinion, are the big kind of movements and trends to look out for?
Thank you, Marianne. That's a very good and I think very complex question, right?
Sorry to start right in the deep end.
I mean, I think, as you mentioned, yes, there are certain aspects that have made it more easy, but at the same time, there is a lot of problems in terms of which laws regulate. Obviously, the UK and Europe are regulated by GDPR. So how do we regulate that? So that's something that at IDDO we really try to make it as easy as possible, because we do understand that, you know, different regulations might make it harder while we're trying to simplify it, right? One other problem is also the lack of funding that there can be, because data can be available. IDDO provides data, but, you know, research takes time. Researchers do need funding. Are funding opportunities always available? What's actually, we try to answer all these questions to ourselves, and obviously it's really complex. It's really, really complex. We do try to support as much as possible. We do try to learn more about, you know, different ways in which, you know, data can be shared in a much easier way. But it's very complex. And also, traditionally, one other thing that I think it's important to remind ourselves, traditionally, data ownership was very different from what data ownership is now. So, you know, researchers spend a lot of their time, funding to collect data, and then in the past, they might have not seen the benefit of their work, right? And might be reluctant of sharing it. And this undermines the, you know, what we're trying to achieve as well, right? So it's quite of a hard way to position ourselves, because it's such a complex world. We do understand that, you know, we're regulated by certain laws, others might not. And yeah, we understand that also people might not be aware of us. People might not be also acquainted with the system that we use. So there's so many aspects that need to be taken into account, and we really try. But it's especially with also AI. It's a very complex. I think it's very hard to just have a hard position or like a hard stand on where we are at. But we're definitely taking these things into account, as I said, and we're also trying to learn to improve our metrics, because as you could see, the vast majority of the data sets were shared with people that were based in LMIC, in high income countries. And we've seen an increase of researchers in low and middle income countries, but we do want to see much more than what we actually see right now, right? So I hope that answered your question.
Absolutely. And, you know, at ISNTD, we're big fans of IDDO. We totally agree that you put a lot of thought and into a very complicated problem, and we can't wait to see how, you know, things develop and grow. And it's interesting because just picking up where you finished off, there's been a great comment by Moses Aaron in the chat saying that, as you were pointing out, Shanti, out of the those who have requested the data, 90 are in high-income countries against 35 only in low and middle income countries. Should we say there is a gap in awareness in the existence of IDDO, first of all? And if yes, what are the plans to make sure the wider community from which the data is coming can also benefit, especially in publications for decision making? And I might just add something to Moses' comment and say, well, what can we do as well as researchers and perhaps those who are on the call to support IDDO in reaching a wider audience? Because we felt that at ISNTD, we think it's an amazing resource, a great team, and one of the reasons for having you on board today on ISNTD Connect, we really wanted more and more people to know exactly what you offer and all the, you know, the wealth of data that they can access. So a great question and a really good topic here about how can we increase exposure of IDDO? What can IDDO do, but what can also we do as well?
That's a very good question. Thank you, Moses. I think we're trying to, you know, expand our networks by going to different conferences, presentation, taking the opportunities also to connect with organizations, projects, and institutions like today. I think that would be a great start. Mm-hmm. Obviously, we do work with institutions or universities also. I know an example, Cape Town in South Africa. We've got some people in Ethiopia. So it would be good potentially moving forward that through these institutions, we manage to reach out to, you know, the broader staff or students, PhD students as well. We try with media because the good part of having technology is you can share via LinkedIn and other means as well.
Yeah.
But I do think that, you know, through like an event today, if anyone's interested, you could definitely reach out to me. I will leave my email in the chat. It would be good. We also try to learn and find opportunities to speak about IDDO in different different aspects of IDDO's work, and in different countries to different audiences as well. So it's a process. I think we're trying to get there. But I think this is the way to go. And I think it's very nice to connect on a personal level with people and learn more about organizations that just simply, for example, reading about it.
Fantastic. Yep. And we totally agree with you there. And we are looking forward to supporting you. And as you said, even something as simple as a LinkedIn post can really help. So that's what we can do. And we wish you lots of success in reaching new audiences. Shanti has very kindly shared her direct email in the chat. If you're not on the chat, it is shanti.rochester@iddo.org. Moses Aaron saying, it is a process, thanks, universities would be a good entry point. Absolutely. Perhaps, and I know you've touched on this at various points in your presentation, but coming back to, if we drill down now a little bit at looking at the scope and remit of IDDO, the diseases covered, the cross-cutting issues covered in terms of the data, you had a really great slide, and I hope I don't do this wrong, but I could also try and just share it from my screen. It was just really to encourage anyone who's on the call and who's specifically in a disease area. So let me try and find.
I mean, in the meantime, I can just explain to anyone, but the diseases we currently have, so this is now updated. So antimicrobial resistant is active. So it's red now. But also for anyone that's interested beyond potentially sharing data or maybe wanting to access it for the purpose of research, we also are looking for members of the Data Access Committee. It's an open nomination process. You can learn more about it on our LinkedIn page or our website. So if you're an expert in a field that is relevant, it doesn't have to be only disease related. We have people that are focused on ethics, on governance as well. You can send your CV, a brief description, why you think you are a good fit, and you could become potentially part of this if you're interested. And I think that would be a very good experience for anyone interested in any of this work. So it would be for malaria, COVID, visceral leishmaniasis, schistosomiasis, Chagas, and antimicrobial resistant at the moment. So potentially someone for Ebola as well, if anyone is also from Ebola affected countries or neighboring countries as well. So if that's also helpful.
Thank you. Absolutely. That's been heard loud and clear. And, just on the back of that, one of the aims of these ISNTD Connect meetings, which I don't know if those on the call remember, but was born literally on the first day of lockdown as the COVID-19 lockdown back in, I can't believe it's been 4 years. To me, it's like a new thing that ISNTD is doing, but it's not that new. I think we are approaching our 100th episode, and it's been a pleasure. But one of the original aims was also so that despite the limitations, we would still be able to get to know each other. And so, if you don't mind, would it be okay to ask, so how did you get to the point where you are now? You're data governance officer at IDDO. What's your academic background, or what has your pathway been? Yeah. It's really fascinating.
So I'm a political science by training, which means a lot, but I'm not concretely. It can be a lot of things. And during my time, I conducted field research. So I was collecting data on maternal and infant mortality across Uganda.
Yep.
So I recall at the time the difficulties, because I remember this was part of my dissertation. I was really young and I knew how hard funding opportunities. I didn't know much, but I just thought when I got into starting this project, it was really, really hard. And I really became fascinated in public health, global health, and also research. But I was on the other side. And I went on to a master's at SOAS University of London, where I delved a bit more into the intersection of public health and gender. And I was using my data, but once again, I really found it hard to, I didn't know where to find data. I didn't know how to ask people for data. So it was just kind of using my own data and just reading articles. And I remember being really time consuming and really, really hard. And I started doing a bit of research. And when I was doing this research, I was also learning about the different aspects and regulations behind data, because whilst you're collecting it, you just learn about what you're doing, which is kind of niche. It can be very narrow. So I started learning more, and following my master's, I was really looking into something that connected my interest in public health and being on the other side and actually, seeing where the data could go, who could use data, and what the process is, how long does research take to affect policy, and how does it work, right? Because it can be very complex, and if you're not acquainted to it, it's just a very fascinating world. So since then, I found IDDO. I was doing some research, and I became the data governance officer, and yeah, here I am.
So now the future of the field in your hands, Shanti. Yeah. It's a really exciting time to for data. There seems to be so many opportunities for sharing. So yeah, your work's really important. Uduak Inyang is saying, well done, great researchers, tuning in from Nigeria. Thank you. And we had a great suggestion here, Moses Aaron, saying, I hope we can add snakebite. It can be included, I can be included as part of the team for snakebite. So I think your call for partnerships is being heard loud and clear, and it'd be really interesting to see the ball rolling on that. Any last questions, please do go ahead and add them in the chat for our speaker, Shanti. And just, while everyone gathers their thoughts, maybe for a final question or a comment, I just wanted to ask you if there's anything else you wanted to add, whether it's in terms of the next steps for IDDO or just generally what we might need to be thinking about as a tropical health or global health community when it comes to data. It's I think, as you said, data a few decades ago is very different to now. The whole open access movement is becoming really ingrained in everyone's thinking, and obviously technology keeps opening up incredible permutations of possibilities. So what do we need to look out for, and or what's the future for IDDO?
Well, I think at this point it's about a collective effort, right? The way I see it, global health is global, right? It affects all of us. We're all here because it's a common interest and it's a common passion, right?
Yeah.
We, as IDDO, we try to provide solutions and ensure, for example, that credit is given, and we try to answer those questions to those that might not be sure about it. So again, if anyone knows or yourselves are interested or have questions about ownership, these kind of things, there's a lot of literature, but also please feel free to reach out, because that's very important, and I think that's the way to go about. And I suppose, for us, we're trying to improve. So we're open to hear what could be, could be helpful to people in different settings, people that need to buy from different regulations. How can we simplify that if possible? Because obviously we need to find a middle ground. And, we all abide by different regulations. But I think for us, it's important, if you know from today about IDDO, and someone that might be interested in IDDO, please, share the word. But if you do have an experience with IDDO, or, from anything you learned from today's talk, and you can have suggestions, it's very important to us. I see that the audience, a lot of people come, are maybe located in endemic regions or regions that are affected by some of the diseases that we tackle. So it's really important for us to learn from the people that might, going back to the metrics, that might not have the opportunity so far, or have had the opportunities, potentially the funding. So, collaboration is the key at this point.
Shanti, thank you so much, because you've given us a lot of food for thought. There's remains a lot of imbalances in research, in global health research, tropical disease research, and it really sounds like getting the data sharing and data reuse, access, the governance of it right, could be an amazing tool to quickly rectify some of those long-standing imbalances. And what's been really lovely about your presentation and just the way you are is how open you've been about collaboration feedback. I'm assuming good and bad is both always very useful. So we get a great sense of openness and engagement and collaboration from yourself and IDDO. So that's been really wonderful, and thank you very much. I see there aren't any more questions from our audience, and we've kept you quite a long time from what is no doubt a busy day. So we're really very grateful for your time, and we will be keeping in touch and keeping an eye on all the great work at IDDO, particularly those programs that are being developed at the moment. And just to reiterate that call, if anyone wants to get involved at various levels, either in terms of the data or the structure of IDDO itself, then please don't hesitate to get in touch with Shanti.
Thank you.
Thank you so much. And on that note, I think it will be a good time to bring this webinar, this session, to a close. If you do have some time on Friday, September 20th, we're going to move and travel to Basel at the Swiss TPH, the Swiss School of Tropical Health, where we'll be helping to moderate a whole day looking at the NOMA research agenda and defining the next steps for this disproportionately neglected disease. If you are able to tune in, then please do so. But if not, we will see you next week. It's World Rabies Day coming up, another exciting and different topic, and we'll have a really great panel on at that day. So some big thank yous coming in from Ikram Guizani. Thanks to all. Oh gosh, keep shining, Marianne and Shanti. Wow, we will, right?
Thank you.
Thank you. Eleanor Raj saying thank you, Shanti, and ISNTD Connect, a very interesting session. I do agree. Wafa Ibrahim, thank you so much. And finally, a big thanks to our international audience, and see you very, very soon, hopefully in the next few days. And do get in touch if you too would like to present at ISNTD Connect.
Thank you.
On that note, a big thank you. Keep safe, everyone, and we'll be in touch very soon. Thank you, Shanti, and to the whole team at IDDO.